Hello everyone, good afternoon and welcome to the Boardroom. As always, we are live on Facebook today, so please do add your comments and your questions below. We'd love to put them to our interviewees and I know they'd be happy to answer them. If you don't manage to catch us live, don't worry, this will be streamed back on who'swho.mt, Malta's leading business portal. We are, of course, at a very important stage for our post-COVID recovery, and this week we find ourselves hitting what many are calling our second wave. And to help us understand more about that stage of the conversation, we are welcoming three top medical experts with us today, and they're going to be giving us some insight, not just on the current situation, but the wider medical economy. So to have that conversation today, please welcome to the show Raina Rodrigues. She is a surgeon specializing in plastic surgery and CEO of Aesthetic Virtue, based between Malta and the UK. We have Dr. Kristen Buhagiar, who is a doctor specializing in family medicine and a director at St. Thomas Hospital. And we have Professor Victor Grech, who is a specialist in paediatrics and also a member of Tabit, which is a new online platform to help doctors and patients communicate in the new normal. Welcome all of you to the Boardroom. Thank you so much for being here. So I'm going to launch straight into the conversation. And Professor Grech, I'd love to come to you first for your insight in the developments of this week and your thoughts on that.
Interesting, because I actually published a paper on exactly this subject about a month ago. I sent you the link, so if you want to post it on Facebook for the followers to read, they're very welcome.
Thank you.
Essentially, tourists are going to look not only at the cost of the flight, the cost of the destination, how expensive it is to eat out, but also going to look at what perks countries now offer vis-a-vis COVID. Like, for example, Cyprus will give you a holiday back for free if you have to go into quarantine, for example. They will also be looking at COVID numbers. Any canny traveler will look at how many COVID cases there are in a given country. So the crux of the paper, the conclusion, which I did with an economist, was that obviously we are now in summer. Tourism is expected to decline worldwide 80%. So this is now a badly needed resource. Many jobs depend on tourism. So countries who have small numbers need to keep these small in summer. Countries who have high numbers need to stamp these numbers down to attract any kind of realistic numbers of tourists in summer. That is how we should be tackling this as well.
Thank you, Professor Grech. And with that in mind, I'll come back to you as we go through this conversation, because there's some fantastic insight, not just from a medical perspective, from a tourism perspective that I know our viewers will be interested in. Dr. Rodrigues, I'm going to come to you now. Just again, for your feedback, you are based between Malta and the UK, so obviously you are experiencing this differently, but perhaps you've been following, I'm sure, the Maltese situation and how things have developed. What are your thoughts on it?
So, up until about last week or 10 days ago, I was one of the people who was really impressed with Malta's handling of the situation and with Malta's bounce back and recovery. However, I don't still hold that opinion, because at the moment, from what I can see, the outlook and the approach has been one of an economic short-sightedness. There's going to be short revenue stream, which will be good in the short term. However, the impact of a second wave, which is what Malta appears to be going through, is going to be larger. And then if we have to go back into lockdown, etc., a lot of people from the tourism sector will lose faith in Malta. I can tell you, I'm having a baby in 4 days' time, and my mother is flying up. The flights are empty. So I think people are getting scared. Plus, our tourism in Malta, if we have to see the tourism stream, is not purely people coming to party, people coming to learn English. There are a lot of retirees who come to Malta and spend long months in Malta. We are jeopardizing those tourists coming in. From a medical economic perspective, yes, I run an aesthetic, as well as being an NHS doctor, which has been affected in one way. I run Aesthetic Virtue, which is a small chain of cosmetic medical clinics, which are obviously non-essential to survival. So we have seen 100% stop in revenue, which is to be completely understandable. However, my worry is that if Malta is going to be so, let's say, gung-ho about just bringing tourists in, letting them mingle. I think from that point of view, people who have bridging businesses over both countries, both sides will be affected.
Certainly. Thank you. And great insight there to start our conversation. Thank you. Dr. Buhagiar, coming to you now for a bit of your thoughts on the past week or so. Obviously, you are a director at St. Thomas Hospital, which was involved in the COVID response locally. What are your thoughts on how things have now changed?
Since 1 week ago, we started seeing a spike in another peak going up with COVID patients. We spent 1 week at the hospital. We did not admit one patient. And actually, we were at 0 COVID patients for a whole week. And then suddenly we started getting admissions again. In 3 days, we had 5 admissions. So then we are seeing a large number of patients out there in the community being infected with COVID. And the MAM, the Doctors Association, are now obviously telling the government to pull up their socks and try and hold back more restrictions for events and gatherings.
Absolutely. And Dr. Buhagiar, I'll stay with you. I mean, talk to us a little bit about what the past few weeks have been like previously. You've been heavily involved in an operation that was dealing with COVID. What has that been like?
We have been admitting patients with coronavirus since February. And overall, we had 104 patients throughout these past 5 months. Initially, it was quite hectic because we were, obviously, this was something new for us. We are a private hospital, so we did expect when we decided to take on this road, we did expect the regular patients not to come, basically, to St. Thomas Hospital because they would be afraid that they'll get infected. And there was definitely a dip in the number of walk-ins and the surgeries being done. So for a time, it was our attention and our focus was purely on the COVID patients. As the situation stabilized, the doctors felt more comfortable to come back and hold clinics, not just at St. Thomas Hospital, but anywhere. And we were seeing more walk-ins, more people booking for appointments and surgeries. So we saw a rise in that. And until now, people and doctors are not canceling their appointments and their clinics. We'll see what happens in the next few days.
Okay. Thank you. Dr. Grech, I mean, if we had to look back on Malta's performance in the few weeks prior to this, we would have said that Malta had done quite well. Could you give us your thoughts on what was done right then and perhaps what wasn't done right in the interim that has seen this spike start again?
What we did right was we overreacted to the public health directives. We did not have complete lockdown mandated, but we saw what had happened very close by in northern Italy. And I think none of us wanted these scenes reenacted over here. Mm-hmm. I think we were about 3 weeks behind them. And they have very extended families, so grandchildren meeting grandparents, similar to ours. So although we did not have lockdown imposed, people went into lockdown. The streets were empty. Unfortunately, this gave some people the idea that the war is won. Well, we had won one small battle. I am reminded of Tedros, the WHO director, who last week said, every time you go out and meet someone, consider it a life and death decision. Because actually, it is. What did we do wrong? Well, the numbers tell us what we did wrong. Because what we did wrong was completely against public health advice. Social distancing. You cannot have social distancing in a festa. So some of the numbers we saw came from a festa. You cannot have social distancing in a party. Many of these came from a party. That's what we did wrong. Our union is now mandating that meetings of more than 10 people not be allowed. The counter proposal by government is that it will be gauged on floor area. Now we know in festas, no matter how wide the street is, people will cluster together. So festas have been banned. Now, if you were to hold a 100-person gathering in a very large wedding hall, where people can stay 2 meters apart from each other, people are not going to stay 2 meters apart from each other. It really is very simple. So this is why the union, I think, is insisting on mandating absolute numbers rather than numbers per square meterage, because people just vote. It's human nature, and especially the young. If you look everywhere in the world, the young are driving COVID at the moment. The young released from lockdown and partying. This is the honest truth. Look up online and you will see what I mean.
And Professor Grech, I'll stay with you perhaps for your insight on how this affects the wider economy. Obviously, we know that there are people calling to keep things going. The government has been very public about the fact that it wants to keep going because the economy needs to keep going. But perhaps is there something that people are not understanding about how linked this kind of spike is with the wider effects on the economy?
We all want the same thing. We all want the economy to restart as much as it can. The problem with these parties is that these people that come to parties come here to party. They're not going to go out to see the sights. They're going to spend money in restaurants. They come to party. Quite frankly, it's a bunch of youngsters who come here to get quite drunk. Let's call a spade a spade. If any of you disagree with me, please shake your heads. None of you seem to be shaking your heads, so I will take this as assent. I'm sure no one is listening to me and thinking otherwise. So this is a very, very, very short-term game. They will leave very little money behind them. We can quote that several thousand came, and they will bring with them a lot of COVID. What we really want in this country is the usual tourist who comes here, sees the sights, goes to the restaurants, goes around, and spends decent money. That's what we need here. Parties are not going to be very, very helpful.
Okay. Thank you, Professor Grech. And Dr. Rodrigues, I'll come to you now. I mean,
Call me Raina, please.
Hi, Raina. So, Raina, I'll come to you now and just ask you, how can the medical advice that we are being given by our doctors, by our medical professionals, actually contribute to the benefit of the economy? What should we be listening to if we genuinely want our long-term economy to survive, rather than by taking a short-term approach?
I think the faith, when you're booking to visit a country, the faith you'll place in booking your holiday is that it's not going to be very volatile, that you want to book a place that's stable and that is not going to change very, very quickly. So if I'm going to book a holiday in a month in advance, probably I want to know that that country has a track record of managing its COVID, which so far we had, and that boosted confidence in other European countries to come to us. Now, I've read Victor's paper. I know our GDP, the percentage that's according to his paper, the percentage that's dependent on tourism is really high. We cannot afford to sabotage long-term gain for very, very short-term gratification for us. And us coming across on the BBC, this is basically what I felt living here in the UK. Seeing on BBC is Malta is your party destination now. It'll just make everyone sigh and go, right, that's off my list then. So you've garnered a tiny percentage of the population for very short-term gain, frankly, to make, as Victor just said, to make a few people rich, to make us look as though we've got it. But our figures are our figures, and they won't lie. Now that if you see per capita that our numbers have gone up, that's it. That's Malta off for a lot of people. So I think in terms of economy, I think this was very short-sighted. And I think if we adopt the strategy we had, and if we're going to try and attract people, let them know that Malta is being safe. Come to us because we are safe, rather than come to us because we've thrown caution to the wind. I think if you say, come to us because we're being safe, we will win. We stand to win more.
Okay, thank you very much. Dr. Buhagiar, I will come to you now for your insight on what you think we should be doing. How would you, as a policymaker, bridge that gap between the economy needing to be kickstarted and still growing, but at the same time making sure that we're doing that safely? Do you have any thoughts on that?
I think everyone has to be pulling the same ropes. I think what really got us was that, as Prof. Grech mentioned, that we overreacted initially. So people went into lockdown, especially the vulnerable and the people over 65. And we want to, now especially that the numbers are rising, we want to keep that, so that what we have started to gain in the last few weeks, maybe slightly more than a month, we maintain it for the long term, not for the short term, for the summer period, because I mean, after summer there's winter and possibly another spike.
Okay, that's your view. And with that in mind, how do you see the medical sector, the medical economy continuing to change? Have there been major changes that were brought about, aside from obviously the management of COVID? Have there been things, Dr. Buhagiar, to come out of COVID that you think will change the medical sector for the long term?
I think that during the pandemic, we've seen people staying more indoors and doctors cancelling their clinics completely, and obviously people still needing to see a doctor. So doctors developed like ways to consult by telephone or online. I think the online applications that have been developed will continue in the future. There are some applications who have been like in order for quite a number of years, but they were never really given much importance because no one really needed to use them if there's a doctor just around the corner. But I think the view of healthcare has changed for many people, and the online accessibility of doctor will stay for us for a long time.
Okay, thank you. And with that in mind, Professor Grech, you are part of a number of doctors who are going to be on the platform Tabit, which is an online platform where people can reach a doctor. What do you think are the prospects for this? Do you think that this is what people look for? And on the back of that, do you think that people have changed their needs from their doctor? Perhaps are they less likely to go in to a clinic when they have symptoms? Are they frightened to do that?
Okay, question in two parts. Tabit was launched quite early in the pandemic, and I was one of the first people to test it for the guys and to actually use it. Now it's not just doctors, there's all sorts of healthcare workers on the system. It seems to work well. They've kept it very simple to use, very effective. Consultations trickle in, sometimes because people are afraid to go out, and sometimes because it is simply easier to do it this way. I mean, traffic, parking, you know the routine. There are some things that can be done online, some things cannot be done online. What else can I say? Where will it go? I expect it will grow. The younger generations are more into tech. It's easier to do something on the mobile even than on the laptop. So I think this sort of platform, if kept simple and effective and has the right people on it, will continue to grow. And for many things, it is as effective as a face-to-face consultation, and obviously vis-a-vis COVID, much safer.
Can I add something to that? During the pandemic, there has been developments of apps relating to the symptom tracker for symptoms of coronavirus. I think similar apps can be developed for other ailments, not only symptoms of coronavirus, and that can fast track you to admission, for example, or the app can tell you you can wait. It can eliminate all the queues at emergencies. So these apps can become very common for other situations.
Okay, fantastic. And Raina, I'll come to you with sort of going on from that question. Is there application also in your sector for how we can use online more?
Absolutely. For plastic surgery, and I'm talking about NHS plastic surgery, where we deal with skin cancers and breast reconstructions following mastectomy for cancer, burns, hand injuries, and babies born with cleft lip and palate, apart from other things. For example, I have been doing skin cancer clinics from home using telephone consultations and video consultations. Now, these are not watertight, but they're extremely efficient. And what we've seen is basically more of a more efficient and streamlined service, whereby I can see you and I can see the skin growth you have, and fast track you for surgery or for investigation. Many of our patients are elderly, or they've got children at home, and if you extrapolate this from a COVID era to a non-COVID era, especially, for example, in the UK, where some people have to travel, as much as 60, 70 miles to get to see a plastic surgeon, you avoid, as Victor said, you avoid parking, you avoid traffic, you avoid having to take a day off leave, you avoid childcare costs or carer costs for your elderly parents. There are caveats, though. This is still quite new, so we're still in the process of auditing potential misdiagnosis or misdiagnosis. Sorry.
Don't worry, Raina. It happens.
So there are potential missing diagnoses, and there are also potentials of missed diagnosis, if you know what I mean. Equally, with cybercrime, if we started using Zoom, then we couldn't use Zoom because it wasn't secure. Issues of chaperoning. However, we're working through these issues, and we are overcoming them. I think come the future, this will be a way forward, because at the end of the day, it's more cost effective, both to patient and the healthcare system, and it's providing a more efficiently streamlined service. We can take a history, we can examine a patient remotely. If we've got any questions, we bring them in for a face-to-face appointment. And for other plastic surgery services, such as, in the UK, plastic surgery deals with hands or babies with cleft lip and palate, you can have your non-urgent appointments done remotely to free up a hospital for the COVID patients or acute trauma and to manage active cancers. From an aesthetic point of view, as long as medical legally, you're covered by insurance, etc., you can't really treat patients because that's not justified, right? You can survive very well without your head and your wrinkles, but you can discuss. And what we've seen a big spike in inquiries about aesthetic interventions. People have been doing their research while in lockdown, and we've seen a big spike in alternative income streams, such as skincare, because now's the time to start going with a peeling face. So what this has taught us from the private sector point of view is never depend on one revenue stream, but have plenty and be ready to diversify and adapt, such as Tabit, as the online platform. As soon as it launched, I'm sure many people took it up. I can't speak for paediatrics, but I'm pretty sure a mother wouldn't have wanted to bring her child into hospital, but would rather show you a rash. But you can elaborate on that more, Victor.
Certainly. Victor, before I come to you again, I would love to get your thoughts, Dr. Buhagiar, on how you think that COVID will continue to shape the development of our hospitals. Obviously, you are a director at a hospital, and I'm curious, Are you seeing things differently as a result of the challenges of COVID?
Definitely. What I learned from this is that you have to jump on the bandwagon, basically, and move according to the times. If there needs to be online consultations because people are afraid to come to the hospital, then you have to do that. If there is, you can hold coronavirus patients to treat them and to monitor them, then you provide that service. Obviously, you have to adapt to the situation and to the times and move accordingly to what the people need and for everyone to stay safe.
Absolutely. And as a hospital, were you surprised by anything during the pandemic? Was there anything that sort of shocked you about the response? Anything that you realized had to become the norm? How did things change for you as an operation?
Well, obviously, besides from the normal, like obviously segregating the staff, the staff who takes care of the COVID patients do not mix with the staff who are taking care of the regular patients. We also adapted 2 entrances, one for regular patients and one for coronavirus infected patients, so that at any one time they do not mix. That was initially quite a challenge because we had to think the pathways through the hospital, but the people took it on very well, the staff took it on well, and we are functioning very efficiently in that manner.
Okay, thank you. Professor Grech, I would love to get your thoughts now on when you think we might have this vaccine. We had a number of people write into us before the show asking, is it realistic end of the year? We read in the media, oh yes, there's one, it's nearly ready. By next year, we'll be totally fine. What are your thoughts on how realistic that optimism is? And whether that is the big sort of magic bullet that we should all be looking for when it comes to the recovery?
It typically takes 10 years for a vaccine from inception to launch. That's the starting point. With Ebola, they cracked it down to 5 years. With COVID, there are at least 100 vaccines in development and billions have been thrown at the problem. So I'm confident that it will be a smaller fraction than 5 years. It won't be 5 years. Now, the question is it going to be this year or next year? And there are additional questions. Once we have a vaccine, how effective will it be? And for how long will it work? So, worst case scenario, if we have vaccine, it'll be an annual vaccine, which we can administer with influenza or as part of the same shot. So there are these other peripheral matters, but forget all this. We're desperate for a vaccine. The world has stopped for lack of one vaccine. So I'd like to take this opportunity, if I may, for the anti-vaxxers out there to say, we told you so. World is not flat and the sky is blue. Okay? I've got that off my chest, now I can continue. Okay, the practical problems. Let's say we do get a hold of an effective vaccine, say towards the end of the year. The 3 phases of the trials go through. We're not going to waste time here going into what phase 1, phase 2, and phase 3 means. People can look this up online. But let's say we do have an effective candidate vaccine towards the end of the year. Tried, tested, relatively effective. The problem is going to be distributing billions of doses. There aren't enough glass vials in the world to distribute this. So one way around this might be multi-dose vials, like we used to have in the old days in the health centers. The other issue is that America, having money to burn, has made contracts with all of the vaccine manufacturers so that they get first take of the vaccine. Having said that, the polls show that half of these people who live in the most developed country in the world probably won't take the vaccine even if it's made available. So actually, they may not take that many doses because this is the United States of, God bless us, America. So the less they take, the more there is for us. But silver lining, what can I say? So realistically, in Malta, we are thinking that we may have a vaccine in hand by the third quarter of next year. And this is a realism. Not pessimism, not optimism, realism. If it comes before the third quarter of the year, we will all be ecstatic.
Okay. So a sobering thought there, that this is going to be with us, and that this way of working is going to be with us for at least another year. Okay. Okay. So Raina, with that in mind, I'll come to you. As a medical entrepreneur, what have you learned from this process, and what can other entrepreneurs take away from this process?
I think what we've learned and what we have to, the take-home message is, never get too comfortable with your business model. Never get too comfortable. Never think you can stop it. Never think, I've made it, I've ticked the box. Because a curveball will be thrown at you. Just be prepared to innovate. And in medical sector, it's really important, because we're not conflicted, but we are primarily doctors and businessmen, whatever, second to that. So while being prepared to innovate and being prepared to always just keep that the patient is key and patient safety is first, you just always have to be prepared to be very dynamic towards what we study when we do MBAs, etc., to the macro political scene and macroeconomics and to microeconomics. So be ready that if there is a political shift, if there is an environmental shift, you can't depend on one revenue stream. Even if that is your cash cow and that is doing really well, you cannot just depend on that revenue stream. Fine, prop it up, fine, boost it, but always have other revenue streams to be sure that you are not a one-trick pony, because then one hit and you're out. This is what we've seen. Aesthetics has basically been hit very hard. So if you have other revenue streams, such as skincare products that you can sell, etc., I'm only talking about my business, that is always extremely, extremely useful. Also, keep an eye open for what's happening outside your shores. We can see what happened in Sweden, learn from it. See what happened, how Germany tackled it, how New Zealand tackled it, learn from it. See what people in your industry are doing. Your competitor analysis, you have to keep doing it, but see what other people in other sectors of the industry are doing. For example, people in my example, beauty salons, and people who are such as, my husband is a hand surgeon, what hand surgeons are doing, for those patients who don't need urgent surgery, but obviously their private practices have come to a standstill, because now is not the time to go and get your steroid injection for your hand arthritis. See what they are doing, if they're partnering up with physios, etc. Another thing is, be prepared to work with other people. Competition is not competition as it always was. Competition can mean hand-holding. You know what I mean? If I can't see patients because I'm not in Malta physically, I can't be there because I'm pregnant and we couldn't travel. People who I might have before seen as competition are now my biggest friends, because they're helping my business alive while it's tided over. So these are the lessons that I have taken home. And at the end of the day, other medical colleagues are colleagues. There is no such thing as competition. It's something we learn from day one.
Certainly, thank you. Great insight there for our entrepreneurs watching. And Dr. Buhagiar, I'll come to you next. Perhaps for your insight on what do you think the policymakers should be doing at this moment? If you were a policymaker right now, what would you be setting in stone as we go into this next phase? And perhaps with the new realization that, oh, wow, it's not over.
Certainly. I think they should be putting people more wary that the virus is still out there, that the numbers are again starting to rise, and basically to put people, I'm not going to say under lockdown again, because or close to lockdown, if I can say that, because I was having this conversation with someone yesterday, and initially in the beginning of the first wave, lockdown was, I think, at around 40 cases, and now we are above 100 cases. So what's the difference now? So we have to pull the same rope, really.
Definitely. Yeah, pulling the same rope is certainly something to take away from, I think, the past week, and also communication and transparency. I think that is on our end, on the patient end, what is putting people on edge. Professor Grech, before we start to wrap up the conversation, could I come to you for perhaps the WHO's advice, so the World Health Organization advice on how and what is safe to be doing at this time?
The World Health Organization has actually issued, with foresight, a list of criteria, quite specific criteria, so how to avoid or dampen a second wave by, and I quote, by releasing restrictions slowly. So there are 6 points here, which I list in the paper. Perhaps we can give the link to the viewers. And the points are like this. Evidence shows COVID-19 transmission is controlled. Is it controlled at the moment? Well, we're trying. Public health and public health system capacities are in place to identify, trace, test contacts and quarantine. At the moment, we have a bit of a bottleneck simply because of the huge numbers involved because of the party and the festa at the swabbing centers. The wait at this point in time is 1 week. This is public knowledge. Call 111. It takes 1 week to get a swab done at the moment. Hopefully, this will come down as demand eases. Outbreak risks are minimized in high vulnerability settings. Over here, they mention homes for the elderly, mental health facilities, and crowded places of residence. But if we actually encourage the dismantling of social distancing, then point 3 is flouted flagrantly. Simply because we cannot have parties, we cannot have festas. Workplace preventive measures are established, including physical distancing, hand washing, etc. Well, this is being done. Importation risk can be managed. This is not being done. This simply isn't being done because our importation risks from abroad, as we saw from that single party, wrought havoc on the system. And communities have a voice and are aware, engaged, and participating in the transition. At this point in time, the feedback I get from everyone is that this seems to be a little bit gung-ho, a little bit of blasé attitude. You know, the virus is over. Well, I'm sorry, the virus isn't over. The virus is here. All countries are experiencing another surge. Call it the second wave, call it whatever you like. We'll probably have another one of these when schools start. It's been a bit of a disaster in some countries where schools have started. I saw an article this morning in the New York Times where they've actually looked at risk depending on state and county and how many kids are likely to have coronavirus when schools start in a single school, depending on the size of the school. These are the kind of measures and risks we have to assess, because when schools start, they will have another wave, and so on ad infinitum until we get a vaccine, which hopefully we will take.
Thank you, Professor Grech. So finally, to wrap up today's conversation, and thank you all again for your incredible insights. Raina, I'll come to you. What are your thoughts that our viewers should leave you with today? What is the way forward, and what is your advice?
The way forward is the coronavirus really isn't over. Try and adopt the attitude you had when we were still in the phase of being scared. And as Professor Chris Whitty here in the UK said, fear fatigues, and that is partly what happened. Is as human beings, we get fatigued of fear if the risk remains in front of us. Just try not to. And yes, we all want to boost our own economy, but let us be the Maltese to boost our own economy, rather than a short-sighted view of a quick gain and then long-term morbidity, long-term deleterious effects on our health economy and on the global economy. At least that's my humble opinion. That's the way I see it.
Thank you, Raina. Dr. Buhagiar?
Obviously, keep social distancing, wear masks and the visors, and also look out to how your doctor is trying to develop ways to reaching to you. And if you need a doctor or a hospital, ask. And so that you know the best way to access your doctor or the hospital in the safest way possible.
Okay, thank you, Dr. Buhagiar. And finally, Professor Grech.
One small point, because it's a common question. People keep saying that things will be better in summer, And perhaps this is part of why there's such a blasé attitude. For people who think things will be better in summer and we don't need to wear masks and stay away from each other and not wash our hands, I would like to point them at Florida and the other countries which are experiencing huge numbers of COVID as we speak, with temperatures in the 30s. In the United States, they are now experiencing death of one patient per minute. One American dies every minute. It's the highest death rate in the world. Summer might influence the virus a bit, but the worst things not to do is to give up on masks, give up on social distancing, and give up on hand washing. And so, social distancing, the most important thing, we cannot have mass gatherings.
Thank you. Well, thank you again to the three of you for being with us today. Very sobering advice there, I think, for the way forward, for both from a health perspective and an economy perspective, but one that we need to take extremely seriously. So thank you very much for your insight.
Thank you for having us.
Thank you.
And thank you, as always, for those of you joining us at home or in the office. And we look forward to seeing you on the next episode of The Boardroom.